I'm Shoma Chaudhury. Thank you for watching Enquiry. This past week has seen many milestones. The start of the Ayodhya temple construction, the first anniversary of the abrogation of 370 in Kashmir. There's much to take stock in that, but beneath that, the COVID crisis continues. India now has 40,000 deaths. There's strict, sometimes random rules of travel, lockdowns continue, and economic activity is low. In the midst of that, the Oxford vaccine trials have grabbed global headlines. Could this be the wand the world is waiting for? On Enquiry today, meet the man at the heart of it, Adar Poonawalla, CEO of the Serum Institute of India. SI is the world's largest vaccine manufacturer, and with a footprint in 167 countries, more than 70% of the world's children use their vaccines. But what's making Adar the man of the moment is that he's set to make more than 200 million COVID vaccines by the end of the year, going into manufacturing, risking millions of dollars before the clearances come. So what are the chances of success, and what's driving them to do this? To answer all of that, thank you very much for joining me, Adar.
Pleasure to be with you.
So Adar, of course, the Oxford trial is making headlines across the world, and it looks very robust. You've spoken of all the, upsides already, so I'm going to quickly enumerate it. It's shown 90% sort of a robust immune response. There's been no side effects or very mild ones. The T cell response, which is the body's capacity to fight back, looks robust. And yet there's still a phase 3 trial before this can really be declared safe and ready for, for people to take in. So what's the caveat that's left?
Yeah, let me just clarify. The phase 1 study, which is traditionally, normally always a safety study, that went off well, as you mentioned. It triggered an immune response. We don't know how much of an immune response is still required to fight the disease, and that's what the phase 3 trial will prove. All we know right now that the immune response from 90% of the patients in the trial was there, and the balance 10% also got it as soon as we gave them a second dose. And most vaccines, the traditional vaccines and the pediatric vaccines, and probably the COVID vaccines that are under development will be a 2-dose sort of regimen, because that's how you really prime and then you boost and get a better long-term immunity that we've seen for all other vaccines. It's the same with pneumonia vaccine, the measles vaccine, the pentavalent vaccines, all of that.
Right.
So that's the point. There's no caveat as such, but we just have to wait for the phase 3 to happen, because that will really prove the efficacy.
So would it be safe in saying that there's no real danger of this vaccine proving ineffective? It's more a question of sort of making sure of its efficacy, or are there any pitfalls that might be?
I'm very glad you put it that way. We still don't know if it will protect us against coronavirus. All we know is that it's safe and has given an immune response, means it's working. So there's a good chance that it will protect you. There are other vaccines which don't even show this immune response, so they're not working.
Right.
So the good news was that it is working and it is safe. That was the first milestone for any vaccine to pass. Now we'll know in the next 2-3 months if it's working against coronavirus, and then we can celebrate.
So Adar, there's a lot of anticipation about this vaccine coming through by December. Are you saying that there's some expectation setting that needs to be done? Is it overblown? You've been in this business for decades. How do you see it panning out?
The regulatory procedures are happening, on a very fast track, supercharged basis. I've never seen this in my life. Normally, this sort of thing would take 3 years or 4 years to do. Partly because of the science also being sort of done very quickly, but we're not, again, wanting to rush anything and cut any corners. So the science itself has to take a certain amount of time to prove, like I said, these trials and other further studies to prove efficacy. But the regulatory framework, we're getting approvals in 4 and 5 days, which would have taken 3 to 4 months normally. So that's where each step is being cut short. To be honest, I know people are expecting a vaccine end of this year, but by the time it's actually rolled out to the whole population, it's probably going to take another year and a half after that. maybe even 2 years, dare I say, because of our population being 1.4 billion. So it'll probably be 2 years from now, at least, till every Indian gets the vaccine, even if one proves itself here. So this is what I've been trying to explain to the government, other chief ministers and states as well, that please don't wait for a vaccine or some miracle drug to come, because it's not going to happen. Whatever even comes and gets licensed will be, let's say, partially or two-thirds effective. There is no 100% cure. The chances are reduced a lot. There's an 80% chance you won't get that disease with a good vaccine, but you still have that 20% chance. So, and by the time everyone gets it and all that, so it's going to be at least 2.5 years till everyone gets it. Please go about your normal lives. Keep your precautions, your masks and all these other things. And if you can, work from home or a little bit. But look, not every industry can do it. If you're in the manufacturing sector, you have to come and manufacture.
Yeah.
And other industries. So we'll have to just ignore this and just get back to normal. Keep testing. Be safe for your loved ones, for your colleagues at work. So everyone knows that you're negative. You can't, infect anyone, because a lot of asymptomatic people roaming around also are infecting other people. Not as much, but they're still infecting other people. Otherwise we wouldn't have seen the disease spread so quickly. And look, if you look at the UK and Europe, you're seeing the daily cases that are coming about is on the decline. That's because they've allowed the disease to peak. And it's not herd immunity, but it's sort of a partial herd immunity. You see, after a certain amount of people get the disease or are infected and recover, the transmission rate will also start going down. You will be that much less infected. It's all a mathematical game. If you imagine 10 people in a room, 5 of them have already recovered. So they can't get infected again. And now another 11th person comes into that room. The chances of him infecting those other 5 is 50%. So I think we just need to let the disease take its course. We keep our precautions going. Beyond a point, how long can you keep the economies closed? You can't do it indefinitely. And you can't have multiple lockdowns, because you imagine a vendor or a businessman, small business owner says, okay, now we're opening up next month. He starts and buys all that raw material. He opens his shop, he starts paying the electricity bill, other expenses, starts paying the salary for some of his people, brings them in. And then if the government again announces a lockdown after 2 weeks, can you imagine what his condition? And he'll have a complete mental breakdown and financial breakdown. So this is not what we should be doing.
I agree with you about the lockdowns, Adar, because it's very clear by now that the course of the disease is pretty ad hoc. There are people who've never stepped out of their house who are getting it. On the other hand, you have Dharavi, which is close to achieving herd immunity. But at the same time, it's very scary and confusing for people, because on the one hand, one is being told to wear masks and move out. On the other, there's almost like a COVID stock exchange where, there's this minute by minute mapping of numbers of how many people are falling sick. So all of it, like, what is the clear messaging we need at this moment? Last week, I had interviewed Kiran Mazumdar-Shaw, who's also in the heart of this fight against COVID. And, even she said that on the one hand, she was advocating that wear your masks and go out. On the other hand, she was saying there's never been a pandemic like this. So what is the clear messaging on lockdowns that we need to take?
Oh, let me just correct my statement. The initial lockdown, that big long one, was absolutely necessary. But after that, my point was, don't have repeated lockdowns. Once you open up, then you open up. Don't open, stagger, and then close again, because that causes more harm, far more harm than good.
But what about the severity of it, Adar? There was a sort of prediction that by July we would possibly look at 3 million dead. There'd be 300, 400 million would be affected.
I don't know who said 3 million people would die, but
there was Ramnan, Lakshmi Narayan,
Yes, I know that. That is the worst case scenario. I mean, there's always going to be a range. And if you look at the total death rate of India, which is about 8.5 to 9 million, if we look at a 10% increase to that, so about 800,000 to 1 million more deaths due to COVID, it's still not so bad. But if it happens to anyone or loved ones, it's terrible. If you look at the overall picture from the India standpoint, it's not going to make an impact or set us back.
So
Even
of course, we're just talking in hard
one death
numbers.
is bad. Our CM in Maharashtra has said he can't bear to even see one death. And that's why he say lockdown Pune. And I can understand and relate to that empathy totally. So it's your personal view. So I don't think there's a right or wrong answer. And just coming back to the deaths, I don't know how many deaths have so far happened in total because, the numbers keep changing but even if you assume that 9%, 8 to 9% of anyone and everyone who's being tested in cities is coming positive, that implies 45, 50 million people would probably be having COVID today. That's the rough extrapolation because today, look, you've tested 12.5 million people and 1 million are positive. So that's roughly 9% or whatever.
Yeah.
Everyone you test in cities is positive. Look, other countries have had far more deaths. Perhaps, their immunity is different to ours. We don't know. But what is clear is that the deaths are about 3 times more or 4 times more than flu. But that still, as a total figure and percentage, is not so bad that we need to panic in the way that we're panicking today. That's the point I'm trying to.
Right.
This is not something like Ebola, where 60 to 70% who even come in contact with it are disintegrating and dying on the spot. Then I wouldn't even be having this interview. We'd be sitting in the homes with the doors locked,
Yeah.
So this is not something like that. And, this fear mongering where we've put so much fear into everyone. There are businesses today, and I've been talking to people, their employees and staff are not willing to come, not because they are being stopped. There are cases where they are so scared, they don't want to come out of the house. So that communication between the government and scientists and experts like of whom we spoke about have to communicate clearly to people so that to manage their fear and expectations. Yes, the old elderly, the immunocompromised, those people are definitely more at risk. But everyone else, okay. It's just you're going to recover in 4 or 5 days.
That's the thing, that one should focus on the finite end of it, which is how many acutely need hospitalization and how many are dying,
Yes.
Best, any case, if 300, 400 million people have a fever and there's not much you can do about it.
In fact, that's another point you struck upon. I was talking to some friends of mine who own some hospitals. They said 40 to 50% of the people coming in with COVID don't actually even require the beds. They just need some symptomatic treatment, paracetamol, vitamins, other things, and little oxygen. So if you need oxygen or a ventilator, you should come to the hospital. Don't use up the beds, would be my message, for example. If you've got a light fever and a little headache, because you can self-isolate at home or some other place, and you don't take up the beds. For others who need treatment today, treatment is being denied for so many other things. Yeah. Chemo, heart patients, other procedures, and so many other chronic diseases because there's no place. It's all being occupied for COVID.
So Adar, you're gambling a lot personally and professionally on this vaccine. I believe you spent almost $200 million on it and you're going into manufacturing by August before the final clearances come, and that it could be really risky for you. So what is driving this? What is the philosophy that backs a move like this?
Well, my father, ever since he started in the 60s and when I took over in 2011, we have always looked at humanity first and the gap and bridging the gap between, what is affordable and accessible to everyone. And somehow that's always worked out. If you see what we've done, it's always been to cater to the masses and the underprivileged populations of the world in Africa, India, South America, so many other countries where the price of your products matters. Because of having this philosophy, it was a no-brainer for us to put in our own money and risk it and commit on not only this candidate, but 5 other candidates after this. And that's why it's going to cost actually $350 to $400 million in this year itself, between the capex and the opex. You see, let's say the plant is $200 to $300 million that we've dedicated, which would have gone for other products. But in addition to that, $270 million worth of actual raw material that we've just bought recently. So that's the commitment that we've put in and for the cause. And this came as an easy decision to both my father and myself. That initially, of course, we all were a bit taken aback with the amount of investment we'd have to make in such a short period of time, and that to a very risky one. But we said, ultimately, we concluded that this is something we have to do because it's almost a sort of responsibility for us, being the largest player and one of the only ones who can dedicate this kind of capacity. It would almost be a crime if we didn't.
So, Adar, I'm just going to reiterate this for viewers who are not yet familiar with the scale of what you're talking about. You're basically saying that by the end of December, you could have produced 200 or 300 million vaccines that could well go into a dustbin because the phase 3 trials don't give you the clearances. So, now this is like a really important point, and I'm glad that there's this global spotlight on you because both you and your father at Serum Institute have been committed to the idea of providing affordable and accessible healthcare. You've said you provide vaccines that are $5 elsewhere at 50 cents. And yet you live, you're personally very wealthy and you live a very flamboyant lifestyle. And so what you're proof of is that both things are viable, that you can provide affordable healthcare and yet be very, very wealthy and successful. Now, typically it's seen that both these things are not possible, that it's not possible to provide affordable healthcare because it's not a viable business proposition. So how are you making this happen? And as I asked earlier, what is the philosophy that's driving it? And how is it plausible for you to do this?
No, I mean, even if you look at what I've been doing for the last 7 or 8 years, we've put in a lot of our personal wealth in our charitable foundation that I founded 2 years after my mother passed away. We've been doing that even in education, clean drinking water. We've transformed the waste management in our city in Pune. So we've put in, hundreds of crores in philanthropy and actual work that we've been doing to make a cleaner, better environment, a safer environment. We're helping women also who are being mistreated and molested, fighting their legal battles, including children. So we've tied up with some NGOs to do that. And my wife heads that foundation. So it's not just in our business practice that we have this philosophy. What the firms and companies overseas have been doing is profiteering. So profits are always good because that's what you need to replow into your R&D, to make new products. Nobody's expecting anyone to do it at cost or at a loss.
Yeah, of course.
But what is wrong is profiteering, which is what we've seen where companies hide behind their patents and then make a killing. And then, a claim that, that's required for their R&D and all that. Of course, that's partly true. But that's partly what's wrong with the patent regime, where they grant patents for 20, 30 years, and then you can keep extending them. Our philosophy is for innovation in India, grant patents for 7 to 10 years maximum, right? So that's enough time for you to gain back, and plow back that kind of profit into your R&D. But then open it up for the rest of the world, for other players to be able to make something cheaper if they can. And, that's what we've done with our vaccines, all the products which went off patent. We've clearly demonstrated that we can be profitable and produce high quality vaccines at the same time. We've got our own made in India vaccine for pneumonia that we launched last week. In fact, we've been working on that for 6 years. You can do both, to answer your question.
Yes, so in fact, Adar, we'll come to the philanthropy end later, but I just want to stick with this core business practice. You mentioned the pneumonia vaccine. The big pharma companies typically see you and Serum Institute as a kind of enemy. The allegation is that you guys take the research that they have done and you turn it into cheap drugs. So is there really, for instance, for India to lead in research as well?
No, absolutely. In fact, our pneumonia vaccine is a testament to that. We have not taken anyone's technology. It's been the strains that we've taken from the US. We've developed our own formulas, our own processes, and that's how we've made it. Look, you've got other companies in Hyderabad like Bharat Biotech, which have got their own developed rotavirus vaccine. They're developing their own coronavirus vaccine. So there are a lot of Indian companies making their own vaccines and products as well. So, what used to happen 10 years ago, yes, we were making vaccines only that went off patent. It's because the firms in India didn't have the wealth to be able to do their own R&D and funding to do their own R&D. But now that's changed. But let me just say that we have nothing against the big pharma and Western companies. Both go hand in hand. In fact, today, the world community is working together. Western companies and Indian companies and Chinese companies are all collaborating together to come to a sort of solution and a way to work together. So there's no them and us or animosity that way. Yes, of course, there's always a little competition here and there, but that's in anything.
Actually, it's not just about competition between companies. I was trying to use this moment of global focus on you and on health to establish that it is possible to provide core services of health at very cheap prices and yet be very personally or professionally successful. I mean, that was the point I was trying to drive.
Look, you made a statement that we live a wealthy and flamboyant lifestyle, but we have a very robust real estate business, a finance business. We've got other things that we do. So all our wealth doesn't come from the vaccine business, and of course, it will never be as profitable as a Western company which sells products at 100 times the price in Europe, US that we do. We're selling it for a few dollars or even a few cents in some cases. Even if you look at our turnover, it's just under $1 billion, is about $850 million, versus a vaccine company or the vaccine turnover that a GSK or a Sanofi or a Pfizer makes will go into $5-10 billion, and they make roughly the same amount of vaccines as we do. So you can see the difference in the price parity is at least an average is 5 to 6 times higher. But that's because they mainly sell their products, in Europe and US that we don't. Not yet anyway. We have our plans for some of the products to go there eventually.
I'm just going to persist with this, Adar, maybe because it's of personal interest to me, but also the pandemic has shown that without health, there's really nothing. So the point is that you have remained committed to providing affordable healthcare, even if there was temptation to do otherwise. So what is the root of this philosophy, and, can it be replicated elsewhere?
I think we became very clear in our minds that we're content. So it's only when someone is greedy beyond a point that you just want to profiteer and make and look at only more and more profits. So we've always been very content. In fact, even when, going back about 12, 13 years ago, we weren't launching the kind of products and as many products as I am now because I'm in the driver's seat. My father was always a very content man, and he always taught me to be content in life and never overstretch and try to go beyond a level, take debt and do all these kinds of things that we've seen a lot of people do. The philosophy that my mother always taught me of just looking toward others and looking to help the unfortunate and underprivileged, that's what always appealed to me. And I hope I can also instill that in my children, who I'm also slowly going to start training up in a few years. So it's just a family sort of ethos that we've maintained, and we hope to continue doing that because, after a certain point, wealth doesn't really make a difference. It's what difference I can make or our company can make, to the lives of other people is what really matters to me and gives me the satisfaction. I mean, if you're talking about satisfaction, yes, initially we all chase wealth in our lives, but once we have it, I think you have to look beyond that, to get satisfaction from other avenues. So that's what, we've been looking at. And look, I follow Bill Gates a lot. I think he's one of my greatest mentors, and look at what he's done. So, and we work with him also very closely. So we've learned a lot from people like him and others that we have to look toward, humanity.
So in what way has Bill Gates impacted you? How has he shaped your thinking as a businessman and as a person?
I think he's been an inspiration to a lot of people, both from his ability to create wealth, but then more importantly for me, because I've always interacted with people who've created wealth. But what stands out with Bill Gates is his ability to spend and his commitment and passion to spend so much time. Because a lot of people talk about being philanthropic or doing charity, but just cutting a check and donating somewhere is not charity and philanthropy. It's actually building an organization, which he's done, the Bill and Melinda Gates Foundation, which has a lot of experts, technical experts, financial experts, people who understand technology, whether it's in clean energy, whether it's in vaccines, couple of different education, women empowerment. So he has been able to actually bring about a lot of change, both at a government level and through his foundation. See, it's not just about spending money and calling that charity. It's about making a difference in people's lives, changing behavior,
Mindset. Yeah.
changing the way government looks at policy also, working with the government in multiple countries, including India. So that is what I think everyone actually can and should learn a lot from. And as you mentioned, after my father, who I've learned a lot in terms of business and science, and my mother in terms of philanthropy, after that, naturally, if you had to ask me who would be someone I not only look up to, but I think is done remarkable good for humanity, would be Bill Gates.
You spoke about impacting policy, Adar. Right at this moment, you're at a very pivotal position. People's attention is on you. If you were to use this opportunity to really put out 2 or 3 key messages about mental shifts or urgency priorities that people should have about health, what would they be?
Well, firstly, this crisis has resulted in a lot of good things that are going to come out also. For instance, people really didn't understand the power and importance of vaccines when it comes to protecting yourself against all these other diseases also. In fact, there are more deaths due to pneumonia and so many of these other diseases that vaccines can prevent than even COVID-19. You had all these anti-vaxxers questioning it. They've all now, I think, been more or less silenced. I think some of the other things that have come about and highlighted, at least in India, is our infrastructure, healthcare infrastructure, which now will be geared up, and a lot more budgeting will have to be set aside, I assume, and is already, from the center for health, whether it's for healthcare and hospitals, but also for development of new drugs, vaccines, pharmaceuticals, because now it's very clear, if there's no health, there's no other sector. You see, healthcare was always given stepmotherly treatment.
Yeah.
If you look at our annual budgets in India of what is spent on healthcare and healthcare infrastructure, not just vaccines, I'm just saying overall.
Yeah, overall.
It was tiny.
Yeah, it's
compared to, say, defense and all this other. I mean, if even a quarter of what we're spending on defense could be spent on healthcare, we'd be in a very different situation.
Well, India spends only about 1.28% of its GDP on health. So given the gap between people's needs and what is available, there's huge scope for upgrading on that and really building the health sector into something very substantive. Which brings me to my next question, Adar. The comparison between India and America. There's been really, the pandemic has shown up both the strengths and the failures in both systems of healthcare in India and America. What do you think is our strengths and their strengths? And what do you think is broken about both systems?
See, it's unfair for me to comment on what's broken there sitting down here without actually seeing things in America. But what I can clearly see from here is that what they're doing, at least in terms of the vaccine development, is that they're spending money, billions of dollars, for companies only who can make that vaccine in the United States. So what's happening is that they're missing out on very crucial or critical partners that they could have tied up with outside of the United States to manufacture drugs for them and vaccines for them. So for example, BARDA will not give money to anyone outside of the United States, which I won't use the word broken, as you said, is too strong a word, but it's a flawed strategy. My point would be, don't limit yourself to that, because the amount of different candidates and vaccines that could be made in the US is only perhaps, 20% of what's going on. So in effect, this policy is a slightly flawed strategy, which I think they'll have to relook at.
So, personally, what has your worldview on anything changed after this pandemic? Has there been any radical shift in you?
No, I mean, I've probably worked harder in the last 3 months than I have in total over the last 4 years, because of the speed at which I've had to make these partnerships, arrange funding, arrange the manufacturing, even, giving interviews like this, spending an hour. It's a complete change to what, my life has completely changed to what it was, just before March or February. Of course, I'm under a lot of pressure also to perform publicly and internally, where we really need to get things done. Otherwise, I just feel it's a responsibility that everyone is hopeful for, but I feel the pressure to now deliver on that as well. So I think these are the things that have changed. Now we're in a stage where we just hope that all that effort is going to pay off. So
Yeah.
let's see what happens.
Great. Is there one big blind spot the world still has about what this pandemic has taught us and which we've not yet focusing on?
I'll tell you what we mustn't ignore is a more severe pandemic which could come in the next 10 to 20 years. Because of the way these zoonotic viruses and other viruses and our population and the way we're traveling, eating, climate change, all these factors are definitely going to result in a far worse pandemic than this. So I think, if anything, if we can learn from whatever few mistakes we've made or had shortcomings in planning things in terms of infrastructure, mistreatment of some kinds of people and other things, if we can remember that for the next pandemic, I think we'll be wiser and richer for it, and probably have less death and destruction of livelihoods and less chaos and disruption, both in terms of health and commerce going forward. Because every 10, 20, 30 years, there are going to be these outbreaks. So we just need to be more geared up, I think. And if we ignore the fact that this is going to happen again, that could be a blind spot, to answer your question.
So Adar, you spoke about what you inherited from your father in terms of worldview, which was, this absolute commitment to equitable and affordable healthcare. But now that you're at the helm and you sort of have your hand on the driving wheel, is there any new direction you're taking the company? Is there anything you bring to your job, which is different from what your father brought?
Yeah, I mean, as I said, my father was always very content with what he had done and achieved over the last 50 years. And, I've been now doing this for the last 20 years. This is my 20th year in the business. What I've always focused on and my passion has been to bring new vaccines and build the export markets. Back in the day, we were in 20, 30 countries. And just making a few vaccines. Today, we're making almost every vaccine that's known to man. Come 3 years from now, there will probably not be a vaccine that we don't make. In the last decade, we've built a lot of R&D and manufacturing capacity. And that's the third thing that I was focusing on. And that's what we're able to use today. Capacity ahead of demand. So I've been doing a lot of that. There's passion and pleasure one gets in these different deal makings and the satisfaction when you launch a new vaccine at a more affordable price where countries can take it, which they couldn't take earlier because it was too unaffordable. These are the sort of things and direction in which I've been taking the company.
If you didn't have Serum Institute to step into, is there anything else you would have more liked to do with your life?
If I didn't have Serum Institute, I don't know what I'd be doing, because ever since I graduated, I didn't really care for anything else. It was my first and only passion, you could call it. And, we just built on that as time went on. Very difficult to say 20 years ago, what else could I have done? I don't think I even had a choice. I, came back, started working with my father, and I realized how important the work was to the world at that time, in fact. It's only 20 years later now that people recognize what Serum Institute is able to contribute, and a lot of the other vaccine companies in India also are able to contribute. Even then, I was very clear that I loved it because I did love, science and business and all that, and in this area particularly. So, yeah, I don't think I would have been doing anything else. And if I didn't have Serum Institute, I would probably do something in finance. I was always interested in, investments and financial dealings. And that's why we've started our NBFC also now a year ago, called Poonawalla Finance. So maybe if I didn't have Serum, that would have been something that I would have probably started 20 years ago.
At least for the rest of us, I'm glad that you're sitting at that chair and your father was there before you. Thank you for talking to me.
Thank you. Pleasure.
And now I'd like to introduce Sanjay Parekh, who's a co-founder and executive vice chairman of Indegene, a technological and digital healthcare solutions company. Sanjay, you've been in this business for very long, and we just heard Adar speak about how neglected the sector is, how much scope there is, and how without the health sector, there's no other sector. So have you seen a lot of changes in the ecosystem? And how do you think all of that is going to impact the future?
Adar is absolutely right. We are woefully ill-equipped to handle the public health challenges that we have. What's ended up happening is, number one, if you think about the interactions between different stakeholders within the ecosystem, if you think of the last mile interaction, that is between the physician and the patient, that's really where healthcare gets delivered. And what's happened over the last 5 months or so is patients haven't been able to come in to see the doctor. The doctor, on the other hand, hasn't been able to go into the clinic or the hospital. More importantly, even the hospitals, clinics, nursing homes have been swamped to some extent, and as a result of which other patients, they've got squeezed out of the system. So access to healthcare has become a problem. And in a scenario like this, one of the things that has seen a huge uptick is this whole area of telehealth, teleconsultations, virtual consults, etc. Now, in the long term, will patients start going back into the clinic? Of course they will. But I think what we've seen through telemedicine is that there is a way to perhaps address some of the accessibility as well as affordability challenges that we always had as a healthcare system. And therefore, I think virtual consultation, telemedicine, etc., will be there to stay, not necessarily for the primary diagnosis, but for follow-ups, things which don't require any kind of procedural intervention, perhaps for a refill of a prescription, etc. And we are already seeing some of that in developed markets. Now, in order to be able to do that, a lot of stakeholders have had to come together. Most importantly, the payer, the insurance companies. Earlier, there used to be a lot of powwow between providers as well as the payers saying, we will not reimburse a virtual consult. COVID hit, and literally within a matter of 24 to 48 hours, payers, regulators, providers all came in line to say, we will lift all the restrictions that we have. So the message we are taking away from here is that when push comes to shove, we have the will, we have the capability of driving change. From Indegene's perspective, one of the other interactions that we've been impacting really is between pharma life sciences companies and healthcare providers, whether it's delivering education, whether it's kind of partnering with them to deliver more direct to home as well as virtual services to the patient. And the last thing really is pharma to pharma. For the first time, really, a company like a GlaxoSmithKline along with a Sanofi have come together to co-develop a vaccine. At a very high level, if I had to say, pharma, healthcare typically has not had a very stellar reputation. It's had a trust deficit with the public in general. But if I had to look at the last 5 months, I would say this has been among their finest hours.
Well, there has been a lot of criticism about the pricing of COVID care. And, there's been, in fact, a lot of anxiety about that. But, we don't have space to go into that. But what is very interesting is that because of the anticipation of the COVID vaccine, there's a lot of attention now on clinical trials. What do you think has been the learnings from this entire experience around COVID? What can accelerate drug development in the future?
That's the other big thing where there's been huge impact. For the first time, I guess the public at large has really become aware of what it takes to bring a drug or a vaccine to market. Otherwise, in lay conversations, it's like, oh, the vaccine is going to come out by Independence Day. Guess what? It's not. The point is that it's a very structured, fairly rigorous, regulated process by which you collect data, whether it's safety data, toxicology data, efficacy, et cetera, and you've got to go through different phases. I think a lot of the public at large has now become a little more aware about that. But there's always been this challenge to the industry over the last several years to say, how can we bring down the time for these trials and how do we make them more cost effective? More importantly, how do we increase the probability of success? Because when we think about the cost of bringing a drug to the market, it includes the cost of all the failures. And therefore, if you think about a new product, it costs more than $2 to $2.5 billion to bring the product to market. So where we think that there might be a possibility of being able to impact this in developed countries, over the last 10 to 15 years, there's been this constant move towards making more and more patient data electronic. Now, there's still a lot to be done in terms of making sure that different databases talk to one another. But given that, if there is so much data that is available, that data becomes analyzable, computable, and more importantly, you can start finding cohorts or clusters of patients who may demonstrate certain attributes or characteristics. If I can do that and look retrospectively and longitudinally at the data, then I can decide that a person is probably likely to respond to this treatment, but this other person has a pre-existing condition which is not likely to respond to this treatment. And therefore, I would design my clinical trial protocols appropriately. I would select my patients based on historical data. And then over time, what may end up happening is with more and more wearables, as well as the ability to kind of have home appliances for healthcare, you might be able to take more and more of these trials off-site into the patient's home and be able to kind of collect data more dynamically and more, shall I say, with a higher probability of success. So that's really where we think clinical trials are going.
Thank you very, very much, Sanjay, for joining me. And, the good thing that's come out of all this is that finally there's white hot focus on health issues. And one hopes that a lot of productive things will come out of the collective damage that the world has gone through. So thank you.